Good evening to everyone. My name is John Murphy. I am a project coordinator for Behavioral Health Network, and I would like to welcome you all to our third episode in this webinar series. This series focuses on a collaborative approach to identifying and engaging youth that misuse substances. This webinar series was put together by Behavioral Health Network and Preferred Family Healthcare, and is designed to be informational and create dialogue around these specific topics. All right, and so just to make sure that we're all on the same page, just a little bit of housekeeping. If you've been on any of the previous episodes, you'll see that this list just keeps growing for housekeeping, just so that I make sure that I cover everything and that we stay on time and on track and everything moving forward. So the first thing that I would ask is, if you are somebody that is watching on Zoom right now, if you could please put your name, your title, and your organization in the chat, just so I can make sure to kind of see everybody that's on here, where you're all from. That would be wonderful. If you are somebody that's watching on Facebook Live, if you're listening through a phone call, you can always shoot me an email, jmurphy@bhnstl.org, and I'd be happy to just kind of record that, but just make sure to shoot me that kind of information. In addition, if you did have any questions, I would ask that you ask at any point in the presentation, but just know that the questions will be answered at the very end, just so we can keep with time and everything. So if you could submit your questions as soon as they pop up in your mind, that would be wonderful, so you don't forget. But if you are somebody that's watching, any other way, just shoot me an email with your questions. The other thing that I'd like to mention is that all of this information is being recorded, so you can be able to watch it later. If you're somebody that has to leave in the middle of the presentation, it's absolutely no worries. And if you wanted the information through a slideshow, through the slides or the presentations, they will be distributed through email if you were somebody that registered. If you didn't register, again, just shoot me an email if you wanted that specific information. Another thing that I've been doing is trying to have as many individuals complete a 2-minute survey. Probably wouldn't even take you 2 minutes, more like 1 minute. And it is a survey that if you're able to take at the end of this presentation, just to make sure that the information that's covered is accurate, it's informational. If there's anything that you would recommend being changed for future episodes, make sure to go to that and complete that survey, and that'd be very, very helpful for me. And then I also want to say that survey link will be at the very end of the episode too, so you don't have to worry about getting it right now. And as always, if you know of a youth or family that is in need of substance use treatment, please have them call that number, 314-399-9794, and an outreach clinician will assist with identifying the most appropriate resources that are possible. It's actually the grant that I work with them, so I can definitely say that the individuals that would help you out if you were to call that number are very great. So I did just kind of want to start off this, as I've been doing every single episode over the last 3 weeks, on what led to this webinar. So as I mentioned, my position within Behavioral Health Network focuses on how medical offices and institutions look at youth substance use and figuring out how to decrease the barriers for early identification, intervention, and referral to substance use treatment providers. So through speaking with various organizations and community partners, it seemed that there were a few themes surrounding youth substance misuse. So if you're on either of the last 2 episodes, you'll hear the same things as I mentioned before. But the first thing that I heard through various organizations, community partners, is that partners that work with youth and families agree that it is something that substance use is something that needs more attention, especially within medical office framework. The second thing that I heard is that COVID has impacted outreach and engagement efforts surrounding how behavioral health services are conducted. And the third thing that I've been hearing is that a lack of knowledge around early intervention and engagement surrounding youth substance misuse and knowing where to refer is also an issue that a lot of individuals vocalize to me. So this led me to believe that the greater St. Louis area may need to look at youth substance use through both a collaborative lens with others doing similar work through as youth substance use treatment, but also looking at how those that work with youth and families may have intersecting needs, which kind of led me to a few questions such as, should we as a reason begin efforts towards substance use prevention as a means to decrease community violence? Another question that it raised is, can substance use screening be integrated with other routine topics that you'd get checked for during well child visits, routine doctor's appointments, and etc. And so really it led me to really think about how can we as a region work more collaboratively. So this led to some identifications of key aspects, which can be seen through the various topics of these webinar episodes. Though not every single topic and intersecting need and issue that youth face are covered, I felt like it really covered some of the key concepts and ideas. So this evening, specifically, we will be hearing from 3 community professionals that come from different walks of life surrounding violence prevention within the greater St. Louis area. Through their day-to-day work, though their day-to-day work differs, they all see various trends surrounding the linkage between violence, interpersonal or community, and substance use. As I'm sure most of you have seen through local news, violence involving youth in the greater St. Louis area is much higher than the national average, especially during this year of COVID. We also know through various research that there exist intersections between violence, substance use, access to guns, learned coping skills, generational substance use, and so many other intersecting identities and needs. However, as a society, we tend to focus a lot more on treating the issues as they arise versus concentrating efforts towards preventing the issues from ever actually occurring. So in thinking of that, I couldn't help but wonder if the intersection between violence and substance use may need to be shifted from treating the issue as it arises to preventing it by focusing efforts towards a trauma-informed approach, resulting in substance use treatment as a means of preventing violence. As I have also mentioned during the last few episodes, I've basically summarized all of these prospective outcomes from the series, but what I specifically hope are some outcomes from this episode tonight are, number 1, shifting substance use treatment towards a preventative approach, i.e. looking at how treating substance use can prevent violence. Number 2, creating new and strengthening existing collaborations, which result in a systemic change. And number 3, looking at how COVID has impacted violence within the St. Louis area. As I mentioned the last few episodes, I always feel it's very important to highlight all the amazing organizations and institutions that have volunteered their time on top of the daily tasks that they already have to be involved in this webinar series. And so without all of these amazing collaborative organizations and agencies, institutions, this webinar series would not be possible. So for tonight, what you'll be seeing are, as I mentioned, 3 different professionals within the world of violence prevention. We'll be really looking at a top-down approach. So we'll be starting with more information from a regional or I guess the greater St. Louis area around data trends around violence within the greater St. Louis area. Then we'll have somebody that will be speaking as a member of the St. Louis Police Department, County Police Department, around changing the conversations and the narrative around opioid and substance use, and really changing the perspective from somebody that is getting, I guess, in trouble for their substance use and changing it to more of a, let's figure out what we can do so that they really get the treatment that they need. And then the last individual will be speaking more like on the groundwork and observations that they see when working with youth and young adults and families, and really sharing specific violence and substance use cases that they've witnessed, and really looking at the linkage that they see on the groundwork between violence as part of a violence prevention project and substance use. So before we jump in with the other speakers, there was one thing that I did kind of want to begin with to provide some baseline information surrounding research that dictates the intersection between substance use and violence. Though we can assume that it's something that does occur, that there is intersection, I thought it'd be really important just to kind of highlight 3 studies. Though there's a lot of words and a lot of information here, I'm just going to summarize them really quick. So the first article that I wanted to highlight found intersections between youth being offered drugs at school and riding with a drunk driver, and some of the intersections with those 2 topics with weapon possession and engagement in physical violent behaviors through the various years that the surveys were completed. So that that research study really looked at the intersection between, like I mentioned, drugs offered at school, riding with a drunk driver, and those being clustered with weapon possession and engagement in physical violence behaviors. Another article that I wanted to highlight focused research within an urban emergency pediatric department in Philadelphia. And this study concluded that those youth with access to firearms were more likely to be male and have higher rates of suicidal ideation behavior, substance use impairment, physical fighting or bullying, and depression or traumatic distress. The strongest associations in the study were between substance use variables and access to firearms. And then the last study was one that looked at age, alcohol consumption, and perpetuating violence. The results from that study showed that non-binge drinking, and binge drinking meaning binge drinking meaning 5 drinks or more for men over a span of 2 hours, and 4 drinks or more for women in a span of 2 hours. And for 13-year-olds that were non-binge drinking, so they were having less than that many drinks, they did have an intersect with violent behavior. So basically that was saying that 13-year-olds that did not binge drink had an intersection with more violent behavior. However, when you looked at ages 14 to 20, binge drinking was robustly associated with violence. And so it was the opposite. It was they only had violent behavior, or more often violent behavior within the individual surveyed in this study when they were binge drinking. Then when you look at ages 21 plus, so basically within the United States, we know that the legal drinking age is 21, there was a relationship between violence and binge or non-binge drinking, or excuse me. However, once a youth arrives at the legal drinking age of 21, the relationship between violence and binge or non-binge drinking dissipates. So basically this study showed that depending on the age in which a youth is and the amount of drinking that they engage in, there are sometimes violent or non-violent behaviors. But to me, the biggest thing was that once a youth becomes of age, the likelihood of them engaging in violent behaviors dissipates. And that's just within the study. I know that there's other possibilities in violent behaviors, but within this study specifically, it showed that age and the amount of drinking dependent upon what type of violent behaviors occurred. So anyway, I know that's a lot of information to throw out at you, but it was my intention to show you all that a significant amount of research exists that proves the intersection between substance use, youth, and violence. So as I turn it over to the rest of the speakers for this episode, I want you as the viewer to think about how the greater St. Louis area can use this information provided tonight to consider new approaches to treating the issues that underserved youth and families face on a larger community collaboration level. So our first speaker of this evening, and I will just give a little introduction to her before turning it over for her to go through her presentation. Her name is Jessica Meyers, and she's the coordinator of the St. Louis Area Violence Prevention Commission. Prior to her work at VPC, Jessica spent 14 years at the Crime Victim Center doing direct service with victims of violence. Jessica is a doctoral candidate in the Public Policy and Analysis program at St. Louis University, and her dissertation research is on police legitimacy.
Thank you. Let me get this shared. So as John mentioned, I am coordinator for the St. Louis Area Violence Prevention Commission, or VPC, and we're a regional cross-sector initiative that looks at how we can prevent and reduce the incidence of violence in St. Louis. And so I'm going to be talking about some patterns and trends on gun violence in St. Louis and a little bit about its relationship to drug misuse. So one of the things to start out with is that we use the public health approach to violence prevention. And so some of the things that I'm going to be talking about are a little different than what you might be used to hearing when talking about violence prevention. And the public health approach is really about first defining the problem. What is violence? What types of violence are we looking at? Where is it happening? And how is it happening? And then we want to look at risk and protective factors. So you can think of this like the flu shot. We know that for the seasonal flu, getting your flu shot makes you less likely to get the flu. But we also know that being older and having respiratory problems make you more likely to suffer complications from the flu. And we can look at those risk and protective factors for crime, just like we can look at those risk and protective factors for other medical incidents. From there, we want to develop and test prevention strategies and assure widespread adoption. So this is really about not just thinking because we've defined the problem and we know what some of the risk and protective factors are, that we therefore know what the correct solution is, or that a solution that works in one city will necessarily work in St. Louis. But this is really about how do we develop and test these different strategies. And so when we're talking about violence, we almost always start out with this quote from the Prevention Institute. And it says, the determinants of violence are multiple, complex, and often interrelated. A successful strategy must include the participation of a broad group of individuals and a range of activities that link with, build upon, and add value to each other. So in our case at VPC, this means that we need to form a group that represents a bunch of different sectors. So we have people that are in education, we have people that are in workforce development, we have law enforcement, we have corrections, we have folks from the courts, but we also have social service providers, public health practitioners, a variety of different groups that even though they may not have a violence prevention program at their organization, still have activities and programs that can act as violence prevention programs. And so we've really worked to build this coalition. Right now we have about 60 member agencies across a variety of sectors, probably twice that in agencies that participate on a regular basis. And so we really want to touch across an entire lifespan, from childhood to old age, and look at how does violence look in all of those different times of life, and how can we prevent violence across the lifespan. And to do that, one of the things that we look at is the social determinants of health. And the social determinants of health are factors about where you live, work, and play that affect your health outcomes. So it's not just your heart rate and your weight and your blood sugar and your blood pressure and all of those. There are actually factors about the place that you live that can affect your likelihood for being a victim or a perpetrator of violence. Things like the amount of vacancy in your neighborhood, whether you have access to health care, including mental health care and substance use treatment. Social and community context. Do you live in a neighborhood with open drug markets? Do you live in a neighborhood that's a food desert and you have no access to healthcare or healthy food? Education is a big factor in determining your health outcomes, and also economic stability. So these are all those social determinants of health that play into your likelihood of being a victim of violence, not only in St. Louis, but across the United States. And to start at kind of that highest level in the United States, about 136,000 people are shot in the United States every year. The majority of those are attacks, so person-on-person crime. 18,000 of those are unintentional injuries with a gun. About 4,000 are suicide attempts. And then about 1,300 are at the hands of law enforcement or correctional institutions. Of those 136,000, about 36,000 people die every year with a gun. But what's important to remember going forward is that these folks that die with a gun are not all murder victims. In fact, the majority of people that are victims of gun violence in the United States die because of a suicide. While about half that, there's about 12,000 murders every year in the United States. And so we really, while the Violence Prevention Commission focuses primarily on interpersonal gun violence, we do want to acknowledge the bigger picture of gun violence and its intersection with drug misuse. That many of these deaths and injuries, whether they're intentionally inflicted by another person or whether they're self-inflicted, have an intersection with drug and alcohol misuse. When we're talking about youth, firearms are the second leading cause of death for American children and teens. The top leading cause of death is motor vehicles, but when you think about it, more kids die of firearm injuries than cancer in the United States. About 3 times more than die of poisoning, almost 3 times more than die of suffocation. So obviously this is an issue that very acutely affects youth. And so that's why it's so important to look at violence across the lifespan. And when we talk about violence and when I go out and do these type of presentations, a lot of people are concerned about the level of violence and how it feels like we're at one of the most violent times because you hear about it a lot. If it bleeds, it leads on the news. And just that 24-hour news cycle where people hear about these violent acts over and over again. But what we know from looking at charts like these is that over time, we're actually at a lower crime rate than we were in the 80s and 90s. Now, that is not to say there's no violence. Obviously, there's a lot of violence. Right now in St. Louis City, we're actually have the highest homicide rate that we've ever had. But overall, we are at a lower violence rate than we have been in the past. There, it was missing for a minute. But one of the things that we want to focus on is that this drop in crime rate has not happened evenly across all jurisdictions. And so, excuse me, while we have seen a decrease in violent crime and in homicide across the United States, there are still pockets of our region where there is very, very high violence rates. So the homicide rate in the United States is about 5 per 100,000. In St. Louis City, it's about 60 per 100,000. I think right now, this year so far, it's up to about 80 per 100,000. But in 2015, and these statistics are a little delayed, the homicide rate in the Greaterville neighborhood, so that's just on North Grand, kind of around Fairgrounds Park area, the homicide rate in the Greaterville neighborhood was nearly 300 per 100,000, 60 times higher than the homicide rate in the US alone. And part of that really brings up our focus on racial equity, because we know that in pockets of high concentrated poverty, we know that there has been systematic disinvestment in these neighborhoods that have historically been primarily populated by Black folks. We know in these areas that have had a lot of change over time, there's been this systematic disinvestment that has isolated these communities and has contributed to these pockets of areas that haven't seen the same drop in homicide that other communities, even just a couple miles away, have experienced. So a couple facts that I think are really important to keep in mind. More than 42% of gun violence victims in St. Louis were under the age of 25. Since 1990, nearly 600 kids have been killed in St. Louis. That's about 10 times the national rate, specifically for children being killed. Also, an important thing to keep in mind is that the majority of non-fatal shootings and gun homicides occur in public spaces, which means it's not just a trauma that the individual and their family have to deal with, it's a traumatic event for entire neighborhoods. And we know that trauma can be one of the contributing factors to drug and alcohol misuse. So recognizing the community impact and the community trauma created by violence in St. Louis is especially important when we're looking at the intersection of violence and drug and alcohol misuse. So everybody always wants to know when we're doing these presentations, you know, how does this year compare to the year before? Or what does this look like in comparison? And so these are through the end of August. If you know anything about police data, there does tend to be a bit of a lag. And so I wasn't able to get the September. Melody is nodding. I wasn't able to get the September statistics, but we are looking at a rise in crimes against persons across St. Louis City and St. Louis County. And this doesn't make us unique. If you have watched the news, cities across the country are dealing with spikes in violence, whether it's Chicago or Baltimore or New York. Similar cities are seeing a similar spike in crime. I think when the shelter-in-place orders came out and people were staying at home, those of us that were working in violence prevention were kind of fingers crossed that maybe we get a bit of a reprieve from the violence. And that's just not what we've seen. And so aggravated assault is up about 10% in St. Louis City, and it's up almost 40% in St. Louis County. Homicides are up in St. Louis City almost 40%. And like I said, this has gotten even worse since I was able to get statistics. But what we're seeing is while crimes against persons, those aggravated assaults and homicides in general are up, things like burglary and larceny are down. People are at home more, which means fewer homes are getting broken into. People aren't out at stores, which means there's fewer shoplifting arrests. So crimes against persons are up, but crimes against property are down. The big exception being motor vehicle theft. And this is something we've seen for years, and something I've talked with both city, county, and federal law enforcement about, is this concern with youth especially crossing jurisdictional boundaries, stealing a car, whether it's joyriding, using it to commit a crime. Motor vehicle thefts are up across the board, and it's something that we really need to take into account when we're looking at what are the biggest crime patterns. And also it's very important because motor vehicle theft, like crime in general, doesn't really respect jurisdictional boundaries. So there's 50+ police departments between St. Louis City and St. Louis County. And one youth with one stolen car could touch, you know, a dozen or more of these jurisdictions. And so that's why coordination is so very important to addressing violence across our region. It's not just a city or a county problem, it's really a regional issue. So, drugs and crime. You know, it's something that comes up on a regular basis. This is specifically in the city of St. Louis. So these are just, when I Googled like homicide rates and drugs in St. Louis, these are what came up. So Chief Hayden has been very vocal about the link between murders especially and drugs. So in June of 2019, he said at least half of all murders are drug related. 35% involve personal disputes, some of which are over drugs, and 15% are domestic. Just this year, Lieutenant Abishan, who's the head of homicide in St. Louis City, said random fights that escalate, some folks are under the influence of drugs, arguments over stolen money. And Rick Rosenfeld, who is a criminologist, said that his research shows that drug-related homicides remain prevalent. And so there's a couple different ways you can look at drugs and crime. So possessing illegal drugs is a crime, but also there seems to be a link between people who are under the influence or who are otherwise using substances and violence. And so those are the pieces that we really want to get to. What is that link, and how do we parse out how we can respond to break that link and reduce violence over time? Now that's the picture in the city, but this was from the County Board of Police Commissioners meeting, and Lieutenant Colby Dolly was presenting some statistics. And the way that it was classified, you don't see drugs here at all. Now it could be that those are incorporated into unknown, into personal feuds, into robberies. But the important thing is that there are different ways that all police departments report their statistics, and it can affect the picture that we get about crime and violence and the drivers of crime and violence. So one of the things that I want to bring home is that there is only so much that we can see in a snapshot, in a news story, or in a PowerPoint slide, or even in a 15-minute presentation or an hour-and-a-half long webinar. And so it really requires a lot of time and dedication to get to the picture that we want to see. But one of the pictures that we do see is that there are common risk and protective factors for both drug use and for violence. You know, I talked earlier about the public health approach looking at these risk and protective factors, just like with the seasonal flu or with COVID. And so I was on, I think it was the NCADA website, and they had a link that was risk and protective factors for drug misuse. And I took a look at them and I was like, I'm pretty sure I have all these on a slide of risk and protective factors for violent crime. And I looked and they're pretty much the same. Aggressive kids tend to have higher rates of drug use and misuse. They also tend to have greater rates of being the victim or the perpetrator of violence. Lack of parental supervision, low peer refusal skills. When I talked about those social determinants of health, the peers you hang out with are a big determining factor of both your drug use and your potential to be the victim of violence. Drug experimentation and community poverty. Community poverty, community trauma. These are risk factors for both drug misuse as well as violence. And some protective factors, right? It's not all doom and gloom. We also know some of the things that protect folks from being a victim. And that's self-efficacy. Do folks believe they have control and that they can make choices to get positive outcomes? Parental monitoring and support. If your parents are there and they're watching you and they want to know where you're going and who you're with, you're less likely to misuse drugs and also less likely to be a victim or perpetrator of violence. Positive relationships and neighborhood resources. Do you have a safe place in your neighborhood that you can go as a youth to spend time without having negative peers around you or drug use around you? So we're really looking at a common set of risk and protective factors, which means there is absolutely a link between violence and drug misuse. And the last thing I want to say is really about interventions. So when we talk about violence prevention, a lot of people think of traditional public safety. So these are primarily focused around arrest and incarcerate models. So you may have heard about Operation Legend. It's a federal program that pairs federal law enforcement with local law enforcement to increase enforcement, especially in small pockets where there may be high levels of drug use, open air drug markets, things like that. We also have an organized crime drug enforcement task force, and the St. Louis Metropolitan Police Department has a joint strike force with the alcohol, tobacco, firearms, and explosives. So these are more about enforcement. How do we get drugs off the street? How do we arrest the people that have been involved in violence, whether it was related to drug misuse or not? These have a place, but what we're arguing is that using the public health approach, while it includes those public safety interventions, also points to some different interventions at the intersection of drug misuse and crime. So safe spaces for youth. This is something we've heard over and over again with our Youth Violence Prevention Partnership. There's not safe spaces. So either there are safe spaces, but kids aren't welcome there, or they charge a fee to get in, or the places that are supposed to be safe, like parks, actually have drug use and violence going on, and kids don't feel safe there. I know that we're going to hear more about Life Outside of Violence, which is a hospital-based violence intervention program. There's been a lot of discussion about cure violence and the violence interrupter model that looks to prevent violence by intervening in feuds before they turn violent. And a couple things that we're looking at specifically, the first is a 911 diversion program. So one of the things that we've been very good at is teaching people to call 911, right? Everybody, you teach your little kid to call 911 if anything ever happens. But what this has led to is a lot of calls coming into 911 that are not specifically crime related that law enforcement are expected to respond to. And so one of the things that we've been looking at is there a way to divert mental health crisis calls that don't require law enforcement, or drug overdose or drug misuse or drug intoxication calls? Is there a way to divert them or to get treatment to them without going to jail? So a sobering center or a 911 diversion program, to really think differently about what that response looks like. And the other intervention that we've been looking at is a co-responder model. So how do we send trained professionals out with law enforcement who are trained in how to respond to drug misuse, drug overdose, mental health crises, unhoused folks who have service needs, so they can work with those families or those individuals to link them to services while the police are able to do, you know, what police are mainly trained to do, which is to respond to crime calls. And so this is about having service providers embedded in the police response rather than just diverting it. So this is really about thinking differently about how do we link people to services without criminalizing what may be an adaptive behavior to deal with their trauma. So that is my part. I know we're going to keep questions till the end. So I appreciate your time, and I will stop screen sharing so we can move on to the next person.
Wonderful. Thank you so much, Jessica. I think what you ended with is exactly a great segue into our next speaker. All right. So our next presenter is Detective Melody Quinn. Melody Quinn is the Opioid Prevention Initiative detective of the St. Louis County Police Department Bureau of Drug Enforcement. She has worked in law enforcement for almost 13 years. Melody has her bachelor's degree in psychology and her master's degree in business. Her passion is to help bring prevention and education to the minority and immigrant populations in the greater St. Louis region that have limited resources. She's the first detective in Missouri to be educated on and able to distribute naloxone education and medication to the public. Her efforts in prevention and education encompass St. Louis County, St. Louis City, and Jefferson County, where she actively participates in a number of drug prevention coalitions, including St. Louis Crush, Step Up of St. Louis, Rockwood Preventions and Prevention, and is on the board of Jefferson County Drug Prevention Coalition and the Alliance for Healthy Communities.
So, as John said, I am Detective Melody Quinn. I'm the Opioid Prevention Initiative Detective of St. Louis County Police Department. I'm actually on the St. Louis County Drug Task Force. So we are actively working in prevention and education with regards to drug misuse, and getting drugs off the street certainly is an important factor for us. So we have seen an increase of a lot of the negatives in our community. There's been an increase of overdose deaths of 17% in the first 5 months of 2020. And as the speaker prior said, aggravated assaults are up 39% and motor vehicle thefts are up 27% through August of 2020. Again, I couldn't even get the September stats because the government does run a little bit slow with those things, but across the United States, there have been reports of increases of overdose and increases of crime. There's been a resurgence here in the St. Louis area and across the country of both cocaine and methamphetamines. So even though we're seeing a slight decrease in fentanyl, we're seeing an increase of cocaine and methamphetamines. And where we are seeing an increase in overdose, we are seeing an increase in crime. So we surmise from that that they are interlinked, although that could be correlational. So St. Louis County as a whole is trying to understand what the underlying issues are and work toward mitigating those issues and creating a more positive perspective on how to change things. So we have a number of programs here in St. Louis County that we implement in order to help on the prevention side rather than just the criminal justice side. For example, I run St. Louis Crush, Community Resources United Stop Heroin. That's a coalition that was started here in St. Louis County with the police department and the health department in collaboration back in 2011. Also, we have the drug court program that's for adults that, I'll speak more on that. We have Narcan policy and assistance, and then we also have the St. Louis County Jail MAT program. So first I want to talk about St. Louis Crush. Crush is my baby. I will tell you that this is where my bread and butter personally lies, because I think this is where I make the most effective change. So our coalition has dedicated our focus to the minority and immigrant communities of the St. Louis metropolitan area, not just the city, not just the county, but even our neighboring counties. If they need help, we're there. So in that, we try to provide resources prevention, recovery, and treatment options to those areas, especially where they are underserved. And we like to work actively in changing the stigma of substance use disorders and helping people to understand that it is more than just a choice. It's a change in the brain chemistry and the way that your brain operates. And it's not simply, I'm just not going to do this tomorrow. It's you have to work toward a solution and retraining the brain. So I like to show this picture of this little guy here. He's our youngest volunteer that we've had. He's 3, his name's Elijah, and he was just a doll. He was the son of one of our drug court program volunteers who was in recovery and wanted to help other people do that. We had a collaboration with Step Up of St. Louis, which is another coalition I'm involved in. And we've created several programs to get out into the community and provide positive messaging around recovery and treatment, and also options to get into those programs. So we have a social media presence, and I try to keep that up to date, and we're pretty much involved anywhere we can be. We go to town hall meetings. I educate at colleges, at high schools, even some middle schools. I go to businesses and the unions and help train on Narcan and distribute it. So there's a lot of good work that St. Louis Crush is doing. And when we go out into the community, we're trying to engage. We're trying to educate on truly what the difference is between use and substance use disorder. And we have a lot of partners. They're named here. I'm not going to read them out loud. We have a lot of partners that are members of our coalition, and we have a lot of resources available thanks to them. And when we go out, for example, we are preparing to do Halloween like you've never seen, Hunt at Home. So we're integrating COVID and proper social distancing with a Halloween fun and prevention messaging. So we are going out to people's homes, hiding eggs, and they will also find little helpful prevent messages and things that will encourage children to take a different path. So, and then we're doing a teen summit. We were originally going to do it online. As of yesterday, we've decided we're gonna wait and see if we can do it in person in the spring. And then we are doing a You Are Not Alone event. This was originally programmed for April of last year. But now we're hoping for April of this year in the North County, North City area, getting all the gaps filled. With regards to opioid use disorder and substance use disorder. A lot of times people don't know how to navigate the system. The system is difficult. So we want to get out there and educate them on the things that aren't often spoken about, like how to get through the justice system. How do you find an attorney? How do you get to recovery centers? What kind of transportation is available? What insurance is available? Those things. And so we have some very exciting events coming up, and I think that Crush is probably our best way to get into the community and change the script and change the stigma involved. So we also have our 21st Judicial Circuit Adult Court Drug Program. That's kind of like my detective name. Just say that 10 times fast if you can get through that. More power to you. But it's our St. Louis County Drug Court Program, and we are part of the National Association of Drug Court Professionals. So we are educated a lot. We are multidisciplinary, and we work with a lot of different groups in order to make sure that those that are in the system are being supervised, getting the treatment and the recovery that they need, and hopefully reducing their pathway into the jail system. It works well for many, many people, and they get plenty of counseling. It's a voluntary program, and in this program, it can take anywhere from 15 to 18 months. There are certain things that they have to complete within the program and within the steps that they go through. It follows a researched 10 key component of drug courts, And that includes our multidisciplinary team with preferred family counselors, with the Choices program, with the drug court, and the judicial side with probation and parole, and of course with St. Louis County. I am part of that team as well. We collaborate with the participants to help them if, for example, someone had issues with their teeth and we helped finance them to get their teeth fixed. Something as simple as that, which can change the way a person smiles. And as we know, the more you smile, the more positive neurons are going through your brain. So just little things like that can make a huge difference in somebody's life. So we're also getting them all the counseling they need. And it's not just for chemical dependency. It's also for trauma, because we know the more trauma somebody has, the more likely they are to use a drug illicitly. We help with employment and vocation training. And then of course, if there's housing needs, we try to fulfill those and doing advocacy. And all of our volunteers are actually required voluntary hours. So they get out into the community and they tell their stories and they help other people that need somebody to help them get into recovery and treatment. So who's eligible for this program? It's anyone who has a felony offense, dangerous felonies excluded, and it has to go through a PA system where they are fully vetted. And the incident has to have occurred in St. Louis County, and it has to be supervised in St. Louis County. And the reason for that is there's a lot of requirements that these people have to go through to successfully complete this program. And so there's a lot of visits, counseling visits, court visits, PMP, probation and parole visits. So they need to be close by, and a lot of people have difficulty with transportation, so we certainly help with that. Their crime has to be motivated by a drug offense, and they have to understand that there are requirements to the program, and in order to successfully complete the program, they have to follow the requirements. So they get a referral oftentimes from a defense attorney, sometimes from the police department, and the prosecuting attorney receives that referral and then does a full criminal history review to make sure that those dangerous felonies are not attached. If the PA qualifies them, the drug court administrator then does an initial screening and gives them to a probation and parole officer who will then do a full background investigation. That's not just about their past criminal history, but also what drug preference do they have? Where is it that they're using? How are they using their drug of choice? Are they out of those situations where they might be more inclined to use those kinds of things? Then that team member will bring it to the team and we make a recommendation. And then if they're accepted into the program, they then start counseling and get a clinical assessment with preferred family healthcare. So that brings us to our next point. I know a lot of people believe that at this point in time, we are still actively arresting people for drug use. It is not often the case anymore. We understand as a police department and even the federal agencies that I have the benefit of working with, understand we are not going to arrest our way out of our substance use issues. Our community doesn't need additional people in jail. So Missouri has the Good Samaritan Law. And this law is really important because it helps those who are going through an overdose and whoever they're with at the time of overdose, well, specifically the person who calls 911. It keeps them from being arrested for certain crimes. So the reason that this is important is that oftentimes the reason somebody overdoses is because they're left alone or they're using alone. Because when somebody is overdosing, they don't have the ability to yell out, "I need help," or to call 911 for themselves because their body is shutting down. They are physically dying. So this protects the person who is overdosing and the person who calls 911 for the following crimes that you see here on your screen: possession of controlled substance, possession of paraphernalia, keeping or maintaining a public nuisance, alcohol sale to a minor, possession of an altered ID as a minor, and possession or purchase of alcohol by a minor. Also, a violation of a restraining order, probation, or parole. And the reason that final one is so important is because a lot of times people get restraining orders out on their partners. But often those are the people that they're using with. So what happens is if they're using together and there is a restraining order in place, but they're still seeing each other even though the restraining order is in place, if one of them overdoses, the other person, knowing that there's a restraining order in place, will leave and leave them there to fend for themselves. And oftentimes that ends in death. So that is to eliminate people from leaving their loved one who they are used to using with, and encouraging them to get the help that they need so that the person doesn't expire. So the Good Samaritan Law is very important. It helps a lot of people, and if there are still a lot of people who don't know that this law exists and protects them. So get the word out, it's out there, and the police are actively working, especially with groups like EPIC and other coalitions that are out there trying to get treatment and recovery assistance and information to those who are experiencing overdose. Which brings me to my next point. Overdose education and Narcan distribution, otherwise known as OEND, is a very important aspect of reducing recidivism of overdose. And St. Louis County Police Department was the first department to have a certified OEND instructor. That's me. And I have the ability through the state of Missouri to distribute Narcan for free to anyone who needs it. I do this at my events. If someone calls me and needs me to meet with them, I will meet with them. I will educate them, or if they have someone that they love that is a substance user, then I will educate the family on how to use it so that they always have something there. It's just another tool. I know a lot of people believe that that is enabling. I don't believe that's the case. It's a tool, and it gives a person an opportunity to make the decision that I'm going to try and fight this now. And they wouldn't be able to do that if Narcan wasn't available. And all of our St. Louis County police officers are required to carry Narcan on duty. They are required to carry it to all overdose calls, and they were required to bring it with them to the call in case they are the first one on scene. Oftentimes EMS gets there before we do, but when they don't, then we are the ones who are supplying Narcan to the victim. And then through my position, OPI means Opioid Prevention Initiative. Through my position, I also offer policy assistance, education, and Narcan programming to our neighboring police departments. I'm currently working with Maplewood, who is really eager to get a process started for them. And there's several police departments who are really, really trying to change the culture. And the best way to do that is through education. So I go out to those departments, I educate them on what substance use disorder looks like and why it is the way that it is, educate them on Narcan, and help them create a policy so that their officers can go on all calls with Narcan as well. And then we have our St. Louis County Jail. We are the first correctional facility in Missouri to have started a medically assisted treatment program. And this began the summer of 2019. And there are several phases that they're moving into. In the, it is supported through our Department of Public Health, but also through grant money funded through the Missouri Department of Mental Health. And the three medications, which are the three medications for OUD, is buprenorphine, methadone, and naltrexone, Vivitrol. Those are all used in the jail. So phase one, which began again last summer, was to maintain MAT for those who are already currently on MAT in their community. So what they did is when they came in, they identified those individuals as already having been on a program of buprenorphine, Vivitrol, or methadone, and they continued that maintenance while incarcerated. Phase two was initiating MAT for choice participants. So most of our choice participants are involved in the drug program. And it's an already existing infrastructure that works to deliver that behaviorally cognitive intervention. And those participants will get to continue, if they are put into incarceration, they get to continue their MAT. And then phase 3, which is still in the works, is opening up universal screening and treatment for MAT to all individuals. And they are currently working with phase 1 and 2 and trying to perfect those in order to know exactly the best route for implementing a universal screening. And then all participants also have exiting counseling and assistance in getting counseling and MAT outside incarceration once they leave the jail. So it's a great program. We're really proud of it. The St. Louis County Department of Public Health has worked really, really diligently on this, and it's very, very impressive work. So finally, I just wanted to say a little thing about looking toward the future. And is our prevention working? 2018, we saw our first decline in opioid overdose in over a decade. Now, COVID has stunted a little bit of that forward movement, but all hope is not lost. There is still lots to be done. And like our first presenter had said, you know, we were kind of crossing our fingers initially, just hoping things wouldn't get bad. Unfortunately, they have, but that just means there's more work to be done. And we are certainly needing more prevention programming, more resources in those underserved, underfunded areas, because reducing substance use reduces violence. And we're seeing a large number of teens right now in the St. Louis area that are more involved in illegal crime, violence, and substance use combined. And that's room for growth. We can work with that. Unfortunately, in Kansas City, I found this out thanks to the federal work that they're doing down there, that they've determined 80% of their gun violence currently is involving marijuana exchanges, buying, selling, distributing marijuana. 80%, that's rather high. And I think a lot of people misconstrue that marijuana is not necessarily dangerous now that it's becoming legalized. But the problem, like John had said earlier, is that access to weapons increases violence. And because people believe that marijuana is kind of whatever, people are carrying weapons when they go into these drug deals. So if something goes wrong, they already have access. Drug dealers are less likely to carry when they're dealing crack because there's a lot more likelihood for erratic behavior. They're expecting that more often than they are with marijuana. So I think those things attribute to that increase. And then we need to just continue to utilize prevention framework, because offering those treatment and resource services, recovery services, it's helping reduce the rate. Over time, the more we do, the more we'll see an end to it. So will we ever completely rid ourselves of substance use disorders? I don't think that's likely. Even animals in the animal kingdom use substances to get away from reality every now and then. But I think we can do a lot for our community if we continue our hard work. So, and at that point, again, I know that all of our questions are being saved, but if you have a question, feel free to type it down so you don't forget, and we'll move on to the next speaker. Let me stop sharing this.
Wonderful, Melody. Thank you so much for that. And I think your segue also is perfect into our next speaker. So, so our last speaker is Abigail Batha. She has an LMSW, and she's a case manager, social worker for the Life Outside of Violence project that we've heard a little bit about. So Abigail is currently a clinical case manager for Life Outside of Violence project at Barnes-Jewish Hospital in St. Louis. Abigail, also affectionately known as Abby, is a graduate of the Brown School of Social Work at Washington University in St. Louis. She has been in the fields of social work for 12 years with a specific focus on mental health. As a native of St. Louis, Abby is passionate about case management and advocacy for individuals who struggle with homelessness and substance use. In her spare time, Abby is an avid bike rider, enjoys taking walks with her dog, and is a true fan of peanut butter with carrots and apples, which I am too. All right, so Abby, we will turn it over to you.
So, I am a little nervous. Presentations make me a little nervous, so if you hear me rambling, just go with it. So, so again, I'm Abby. I'm with the Life Outside of Violence program. The Life Outside of Violence program, also known as LOVE, is a St. Louis area hospital violence-based violence intervention program. So just to give a little bit more information about it, we are funded by the Missouri Foundation for Health. It was started in 2018, but it had been planned like way before that. It is comprised of 2 systems, BJC and SSM. It has 3 universities attached to it for the study, and that is UMSL, BJC, and SSM. And then there are 4 hospitals that assist with the case management, as well as 1 floater from Washington University. And those hospitals are Children's, Barnes Jewish Hospital, SSM Cardinal Glennon, as well as SSM SLU. And all of the clinicians are basically provisionally licensed or licensed clinicians. We work with participants that are between the ages of 8 to 24 years old that live in St. Louis City and St. Louis County. And basically they are participants that have been injured by community or interpersonal violence. And as previously talked about, there are different forms of violence that can happen. So we have excluded criteria, and that criteria is domestic violence. And we define domestic violence as individuals that live in the same household. So if there is a brother and a sister that are adults, like over the age of 18, and they injure one another and end up at the hospital, the emergency room, we still count that as domestic violence. It doesn't necessarily have to be domestic partnership. It can be sibling. It can also be counted as like a mother assaulting her older, her daughter that is over the ages of 18. We also count that as domestic violence. We also exclude criteria accidental or self-inflicted injuries. We exclude those criteria or those injuries due to there being other programs in the St. Louis area that work specifically with those injuries. So, so far we have enrolled 150 participants. Our re-injury rate of those 150 is 2%. And we've had 0 deaths, yay! And no retaliatory cases, yay! And so far, it's been super awesome. And basically, I guess the mission is outlined above in the slide. However, what I feel like the goal of the Life Outside of Violence program is to decrease violence in St. Louis by assisting victims and their families, because we've learned through previous presentations, thank you ladies, that violence is not just an individual injury, but it is also a familial as well as a community injury. So the whole community and the family is impacted by a person being injured either by assault, blunt force trauma, gunshot wound, all of those. So by assisting those victims and families and the community with resources such as counseling, employment, and schooling, and their basic needs and medical care, we can help decrease the violence in St. Louis. That is the hope and the goal. So hopefully, through this presentation, we'll be able to kind of help demonstrate how love has helped this individual, but also show how substance use and violence is oftentimes interconnected through this case study, hopefully. So diving in, so Tyler, Tyler is our case study. That is not his real name because that would be a HIPAA violation. So he is an 18-year-old African-American male. when I met him, he reported that he was homeless and living in a vacant building, but he was enrolled in a GED program, employed at a daycare center, doing janitorial work. This was his first GSW. And initially, when I had met him and he told me about his injury, he reported that he was robbed at a bus stop, just like a random. He was at the bus stop, just waiting for his bus, and some dude came on him and tried to steal his bag and ended up shooting him because he was fighting for his belongings, so he got shot. So they kept him for longer than what they normally do. They kept him for a week in order to kind of help figure out his home plan, as well as allow me to build rapport to help him enroll in the Life Outside of Violence program. And also, the housing piece is really important because oftentimes when individuals have struggles with housing, it's difficult to get them to medical appointments. So it was very important for us to kind of figure out where he was physically going to go. So then that way we could get his medical care that he needed to recover faster. So with that, we were able to talk to one of his cousins, and he agreed to allow him to stay with him at his home temporarily until a permanent solution could be made. So, so during the time with Tyler, or Ty, we were able to get some things done. Initially, what we do is we do some assessments, and in those assessments, we're able to figure out things like childhood abuse, substance use, education, goals, family history, what they feel like their neighborhood is like, what their feelings are on how they perceive like the code of the street should be. And we do these through the assessments that we give, like psychosocials, risky behavior assessments, things like that. So during these assessments, I was able to learn about him and his homelessness. And basically what I learned is that he had been homeless nearly his entire life. His family had been bouncing around from shelter to shelter and also to public housing as well. And they had never really found a place to live. And so he had actually left his parents to go live with other family members who were avid drinkers and substance users, and he had left them to go and live in a vacant building, which I think is super important because I think that kind of leads to his gunshot wound, because he's bouncing from place to place. And also during the time of his homelessness with his family, this is also where he sustained injuries of physical and sexual abuse as well. But also what he was also seeing was that his parents were also struggling with substance use, which can be determined from the stress of being homeless and needing to bounce from shelter to shelter, and trying to figure out their housing plan. What I also learned is that he was also struggling with his own substance use when he was bouncing around from place to place as a young adult male. And I also learned about his substance use while I was meeting with him, because when I would walk into our meetings together, I would go to his cousin's home, I would just get this huge whiff of marijuana. I was like, "What is that?" And he was like, "Oh, I just smoked." And I was like, "Well, what did you smoke?" And he'd be like, "I just smoked marijuana." I was like, "Are we gonna get anything done today?" He was like, "I don't know." And I could like visibly see like that his eyes were all glassed over, and he was not unintentionally, but he was not able to have those in-depth conversations that we needed to talk about to kind of unpack his trauma that he had experienced as a child and now as an 18-year-old male. And so I found it difficult to discuss his everyday basic needs and how he was going to continue to survive without any money, as well as his anxiety as well, and going to appointments. So we kind of came up with this plan to help assist him with the substance use, and also meet with me, was that if he knew I was coming, he would not smoke until after I left, which I'm not sure if that's necessarily appropriate, but it worked for us. So there's that. So with that, we were able to talk about his fear, which is the anxiety of leaving his home. What we were able to learn is that, or what I was able to learn, is that he had this intense fear of leaving his home and being outside in the community. And with that fear, he was not able to go to any medical appointments. He needed to have medical appointments to attend to his knee for like wound care, as well as to make sure that he was able to obtain the range of motion with his knee. And we had talked about him getting a cab, or family members taking him, or if he felt comfortable taking the bus, and nothing was working. I'm not even sure if he would feel comfortable even riding in a car with me. It's one of our policies is transportation. But what we had talked about is that if people can see inside the vehicle and they can see you, then that's like a danger zone. One of my clients has called it a fishbowl. Your car, if you can see through it, it's a fishbowl. And so that was one of the fears that he had, was that individuals would be able to see him. And so he declined. And so he was not able to go to any medical appointments or any psychiatry appointments or counseling appointments that were being recommended to him. So that was a huge thing that we were struggling with. So we just kind of took it slow and just like talked about like how to work through stuff. And the fear, I just want to like point out how like intense the fear was, because the fear was so intense that I suggested also getting books and things for him for his GED study so he could continue with that. And even that was just like, no, like I can't focus on that. I can't be working on that. I can't do anything because I have to be here and I can't leave this house like to do anything. And it was just like, okay, like we just need to like focus on like coping with that stress and anxiety. However, we didn't actually get very far with the coping skills, because I'm about 2, 3, or 4 months into kind of like figuring stuff out. His cousin unexpectedly asked him to leave the home. And so he had found his parents again, and they ended up living in a hotel for a couple of months. And I would try and find him at this hotel once a week, because we would meet once a week, and I just couldn't find him. Like calling the hotel, trying to figure out what room they were in. It was also one of these hotels in North St. Louis where it was gated, where there are fences around it, and so getting into the parking lot was just like a no-go area. So it was very difficult to outreach him, but it was still like one of those processes. So just one day, out of the blue, I got this phone call from him like 3 or 4 months later. And he had informed me that they had moved into a house, which is very exciting. And we started doing our weekly meetings again. And it was at this time that he informed me what really had happened with his initial gunshot wound, as well as being requested to leave his cousin's house, which is remarkable, because I thought everything I had been told thus far had been, you know, what was real. But what he had told me was that he had been targeted, and that he actually had a gun in his book bag, and that when his book bag was stolen, the gun was stolen with it, and he was nervous about that, and that he was still afraid of people coming to get him. And so we discussed referring him to Better Family Life, which is another outreach program. It's not quite like Cure the Violence. It's almost, but it's a separate thing. But basically what Better Family Life does is that they attempt to mediate situations in order to decrease retaliation and to decrease violence between groups or people in St. Louis, and try to come to a compromise or a truce. And if they're not able to come to a truce, then they are able to essentially move people out of the area. So we had talked about these options. However, what he informed me is that Better Family Life was not an option. And it was not an option because this would be deemed as snitching. And even telling me just a little bit of it was snitching. Like I shouldn't know anything, and that it was impacting my own safety for me to know anything at all. And so that was very difficult for me to accept, because I was like, no, like we have to do this, like, or we have to do something, like if you are not safe, like we have to figure something out. But he was like, no, like I don't think people know where I'm at right now. Like I'm looking around, I'm going out in the community, I feel like I'm okay. And I was like, all right, I was like, just make good choices. Like that's all you can do. And then he had also informed me that his cousin had requested him to leave because there had reportedly been items stolen, which leads back to everything that had happened before, and him trusting me with this information, because I was going into his home with items that are pretty expensive, like computers and things like that, and just him being able to tell me that this is what he'd been accused of, for me was pretty important after us not being connected over several months. So being able to build that relationship, I think is pretty cool and pretty important for us to be able to move forward with talking about transitioning to care longer term, to get him going to medical appointments and mental health appointments, and getting him a longer term case management, because at this time he had reported not needing or wanting to go to medical appointments, as well as not needing or wanting to go to mental health or a community mental health agency, or even wanting to talk about his marijuana usage. So in talking about these situations, we were able to begin to schedule medical appointments, and talking about like safety, like, do you feel safe getting in a cab? Do you feel safe going to your medical appointments? And he reported that he was able to go, and he was able to get medical care for his knee because of that trust that we had built, but also trust that his anxiety was going down through talking about his trauma that he had experienced. And through just building through the medical care, we were able to build to him going to a community mental health agency and getting a permanent case manager. Because with the Life Outside of Violence program, we're temporary. We're only there for 6 months to a year. So part of the goal is to get people longer term care that they are able to have, so that they can continue to build on their goals. So he was able to go to these appointments and receive those longer term services that he needed and wanted. And through these closing assessments, when our year came up, what I learned is, even though his marijuana usage had still continued, his anxiety had kind of gone down. And that was just through building all of these relationships, not only with me, but with all of his huge team of care providers that he had been able to obtain. So that is the end of my program. It's an abrupt ending because I don't really know how he's doing, but I trust that the community mental health agency is taking care of him. So that's all I got. And thank you. Thank you for allowing me to be here. Mine's short.
No, that was wonderful, Abby. Thank you for that case study, because that, I think, goes exactly along with community violence and violence within various communities have so many intersecting needs. And that really gives that insight into that. So thank you for presenting on that. And I know you said that you were anxious and nervous. You did a great job. So don't even worry about it. All right, so with that, I know that we had a few questions on here, so I'm gonna go ahead and reshare my screen. Thank you. I saw you saying something, so I knew you were gonna stop sharing your screen. So let me just pull that up really quick. While I pull that up, I think our question, we had two questions. The first one was from Melissa. She asked, and this was, I think, during Jessica, your presentation, but it can be answered by anybody. Do you know if, I think it was in relation to, I don't know, it was one of the violence statistics that you had provided, and she asked if it was so high, mostly because of gang relation.
So I think that's a difficult issue. When Rick Rosenfeld looked at homicides, he talked about how we actually have fewer gang homicides in the city of St. Louis than we did at one point. Part of that is because St. Louis doesn't really have like the big organized gangs that you see in some other cities. Instead, it's small sets. And they may be as small as, we live in this 100 block of this street, and that's the territory that we have. So gangs, not so much. Retaliation, yes. One of the big things that we've looked at is the DOJ came in and they did a study of the city police department in 2017, and they said, your arrest rate for non-fatal gun violence is really low. I think it was about 1 in 4 or 1 in 5 non-fatal shootings, there was an arrest made. And it's lower than the national average, and it's lower than the similar cities. And so that does lead to some retaliation. And when you don't have trust in the criminal justice system, you feel as though you need to take that upon yourself. Also, when you feel that your economic stability is threatened, then you need to take that on yourself, whether that's, you know, you're selling drugs or you're engaging in other illegal behavior and you're victimized, you may retaliate. So I do believe it's due to retaliation, but just not necessarily related to gangs as most people understand that.
Melody or Abby, would you like to add anything to what Jessica said?
I would agree for the most part that, you know, the major gang organizations that operate out of LA and Chicago, New York, the MS-13, the Crips and Bloods, we do have small segments of that, but they're more like street gangs, literally based on the street that they live on, and they associate themselves as a Crip or Blood depending upon their street's affiliation. We do still see a lot of homicide involved. I would agree. It tends to be because of retaliation, and some of those things are connected to drugs and where they're selling and things of that nature. But a lot of the murder happens because this person did this, and so now we have to continue that cycle. I mean, it's hard because there's so many gangs, many gangs involved. It's a web that it's intriguing to look at the entire picture and see how they're interwoven. So it's a really hard question to answer because there's so many factors involved.
That was, I think, great between both of you and Jessica, kind of your, like, it's a multifaceted issue that you can't just answer in one way. And if it was able to be answered in one way, I think it'd be a lot easier to solve the problem, right? But yeah, so that's a great, great answer between both of you. I think the only other question, though, I believe Paul said that his question did get answered during your presentation, Melody, but I will also throw it out to all of you as well if you do have something to add. But his question was that violent crimes against people jumped up so much from 2019 to 2020, were there similar increases in drug use during the same time period? Did any of you want to take that answer on?
I mean, the short answer is yes. We saw similar increases. I will say that when COVID first hit, we saw a quick reduction in a lot of crime overall. At that first point of quarantine, it didn't last very long. Many of the people that aren't used to being at home, or home is probably not the safest place for them, didn't remain inside the home. So then those crimes started reoccurring. And like John had mentioned earlier, you know, it's hard to break into homes when everybody's at home. So you're seeing a reduction in those things. It's hard to steal from somebody's house when people are there. So you're seeing a reduction, but people are not out in their cars as much. So it's easier to go and snag a car and get the things that you want from, say, shoplifting or something of that nature. And because we have so much, so many municipalities and so many police departments and so many, there's a lot of segregation in St. Louis. People can commit crimes, you know, take Manchester, for example. Manchester has got Wildwood, Ellisville, Baldwin, unincorporated, Town and Country, Manchester, De Pere, all the way down. You hit places all the way down, and it, you know, so the quick answer is yes.
Yeah, I think just to jump into our first episode of this webinar series talked a lot about the current rates and current trends of substance use, more specifically within youth. But from that presentation, if I remember correctly, generally adult rates of substance use have increased or remain the same. I think youth rates are a little different in terms of when you break it down by substance. I believe fentanyl/heroin has remained relatively the same, but I think if I remember correctly, and maybe somebody might have said this tonight too, that meth, crack, and other forms of substance use, in addition to vaping and like, what's the word? Vaping and electronic cigarettes have been increasing during this year as well. Does anybody else have anything to add for that question? Okay, awesome. Let me just check really quick to see if we had any questions from Facebook. Don't believe so. Nope. So the only other things I will add to kind of close out our presentation tonight, unless anybody has any other questions you did want to add it, I did drop in our chat box a survey link to, like I mentioned at the very beginning, a 2-minute survey just to evaluate how tonight went. If you had any additional comments, anything that you thought should be corrected, any really exciting points that you think surprised you or were interesting to you, if you could just go to that link and take the 2-minute survey, you could probably get it done before I even get done talking, just to help evaluate everything that went, how everything went tonight. Our next webinar will be next week, so a week from tonight, same time, same place, and we will be talking about youth families in a virtual environment, how to leverage technology around behavioral healthcare access, and I think a lot of those conversations can be translated into other type of work through outreach and engagement as well. I have a few other resources that I'll go through here really, really quickly. I try to say this during every episode, just because I think they're great free resources that a lot of people can benefit from. We do have our CCP, or Crisis Counseling Program. Basically, this is a line for anybody to contact for free who has been impacted by COVID-19 and their mental health. So it doesn't have to be you had COVID-19, you had a family member that had COVID-19. It's if you've been impacted through this, I would say, continuous and community-wide, nationwide, worldwide trauma that we're all experiencing, and exacerbating of underlying behavioral health needs. This is definitely a line that you can contact for free resources. You can either call or text that number. All this information, like I mentioned, I'll be sending out to everybody that registered. If you didn't register, just shoot me an email, and I will make sure that you get all this information. But this is a great resource that was started just about like 2 months ago and recently received, I think, 2 to 3 years of funding. I did say this at the very, very beginning, but also to summarize it now too, since our conversation is all around substance use. If you are somebody that works with youth or families or parents or caregivers, or if you are a parent or caregiver and you are somebody that thinks that a youth that you know or working with might need access to substance use treatment for free, this is a phone number that I've set up, part of my work, that anybody can contact, call, and within 1 business day, an outreach clinician through Preferred Family Healthcare will call you back and will help figure out the best kind of action for your treatment or for the use treatment for substance use. As I could go into a lot about, substance use treatment isn't a one-fit-all approach, and so this is a very easy and quick way to figure out what is the best approach for you and your family. Another webinar that will be coming up, I think, in a week or two, more for prescribers, but also a great, I think, interest if you had interest in mental health and psychosis. There's a youth and young adult psychosis webinar series, prescribing first episode psychosis. I, again, will send all this information out, so you can definitely register for that if you're interested. And then the last thing to close us out, last thing to close us out is that every Thursday, sometimes every other Thursday, sometimes more than 1 time a week, we have another program through BHN called Bridges to Care and Recovery. I did it again. And they have webinar episodes, like I said, like weekly or every few weeks, that focus on destigmatizing behavioral health within St. Louis area churches. And so the episode that they will have tomorrow at 6 p.m. will be screened live on their Facebook, which is BCR Wellness Champions, or you can go to their link tree, which is Bridges_BHNSTL, and you can just go onto the webinar, access it that way as well. And like I said, that'll be next week, and you can also like their Facebook page to see when any other webinars come up. But I believe that is everything that we have for tonight. Were there any other questions that anybody had before we close out? All right, doesn't look like it. So I just want to say again, thank you all, Jessica, Melody, and Abby, for joining us tonight, speaking about your experience, showcasing some case studies, describing statistics, showing what kind of work you're doing within the community. As I said at the very beginning, I think it's really important that as a larger community, we think about how we can collaborate more, how we can work together and not be so siloed. And I think you all did a great job of discussing how all of those intersecting needs that our community has within the greater St. Louis area, how we can work together. So thank you so much. And we'll go ahead and close out.